Hi folks, Mr. Bleeker here. In our second lesson in studying the circulatory system, I'm going to focus in basically on three areas. The first area that we'll cover in this lecture will be heart attacks, and we want to look at the root causes behind these, and I think it's really important to look at symptomology and look at the difference between male and female heart attacks. There are some distinctions to be made there. We'll also investigate atherosclerosis, which is also called narrowing of the arteries, hardening of the arteries, leads to higher blood pressure, and is a major contributor to heart attacks, to say the least. And then we're going to round out with blood pressure, and we'll discuss what this 120/80 means. So we're going to examine systolic pressure and diastolic pressure and get to the root of what those are all about. It's quite important to look at solutions, finally, to blood pressure. What can really be done? A little bit of a discussion about medications to bring things under control, what some options are. So, this one should be short. So, away we go. So, in the circulatory system, we're still in lesson one. I did want to point that out, which will take you into these animations and relevant material here. So, I'll let you peruse that on your own time. But for now, we should talk about heart attack symptomology. Now, in a heart attack, what's really occurring, and we'll talk about, actually, let's take a gander at what's going on in the heart. So I'll go to the notes for now. There we go. And we'll talk about the coronary blood system. The heart has its own blood vessels. We've got coronary arteries, which you can see here. And there are also coronary veins. And of course, there's capillaries. When you hear the term coronary, you want to think about the blood vessels that supply blood to the heart itself. It is the most important muscle in the body, and it's running on autopilot. It's under control. If you feel on the back of your head, there's a just underneath your skull there. You'll feel sort of this squishy region there, and just go down just a little bit, and at your brainstem, that's your medulla oblongata. That's responsible for maintaining things like respiration and to keep your heart beating. Major predators, by the way, we talked about this a little bit in Biology 11, will bite the back of the neck specifically just to render an animal helpless. If you bite the back of the neck, that's it. The breathing stops, the heartbeat stops, and that's basically the better part of an animal kill. Specifically, you'll see cats. Big cats do that, like cougars. But in the case of a heart attack, we'll come back to that. You've got a coronary blockage that's happened. And we'll zoom in a little bit here. There we go. A blockage, which is sometimes called an occlusion. And in this case, what's happened right there is that an embolism is formed. A blockage, an embolism, what it essentially means is that blood can't flow, there we go, can't flow through this area here. And if blood can't flow through that area, then the resulting blood vessels don't deliver oxygen or nutrition to this area of cells. And this, roughly the way to describe this is, imagine if you had to go on a run and that your mouth was duct taped shut. And you were told you can't stop running, you have to keep running, but you can't get oxygen and nutrients to your muscles. Pretty soon those muscles would begin to scream, lactic acid buildup would become very toxic, and it would kill the cells. And this is what will happen in the case of heart attacks, where the portions of the heart muscle become what we call it ischemic. They're screaming for nutrients, they're screaming for oxygen, they're trying to get rid of their carbon dioxide, and it literally kills the cells in that area. And this, needless to say, can be fatal. Now, it's important to look at what caused the occlusion, or the embolism, is another way of saying it, in that coronary blood vessel. In this case, we're looking at a coronary artery. Well, it comes down to that devil we call cholesterol. Now, there's two types of cholesterol. Um, at your age, typically when you're in your teenage years, you'll hear about this with your parents, and it's men are more prone to this because, well, testosterone doesn't exactly help with our healthy cholesterol. Let's put it that way. There's two forms of cholesterol, largely that are made in the liver, and the first form of cholesterol is a low density lipoprotein. Fancy, isn't it? Essentially, what that means is it's sort of like soft, goopy cholesterol. And what it can do is it can land on the blood vessel on the inside, and it's not just that it starts to build up, but it can calcify, and it can literally become sort of a hard material that's glued onto the inside of the blood vessel. And that's not good because it builds up over time and it'll obstruct the blood vessel. Now, there's good news here. There's some good news. You have good cholesterol. Instead of that sort of soft, goopy, buttery like cholesterol, you've got one that's called high density lipoprotein, or HDL. Now, high density lipoprotein, right here, this version, is the scrubber. And it's almost like you can almost think of it as like, well, it's not fiber because it's not a carbohydrate, but it scrubs like fiber. And you'll find this kind of good cholesterol in fish. You'll find it in nuts. There tends to be a high quantity of it in things like that. You might have heard of the Mediterranean diet. Societies that consume a lot of fish in particular, and nuts and healthy things like that, you get a good dose of high density lipoprotein, which will scrub and even remove low density lipoprotein that's blocking a vessel. So it's good to eat fish. In fact, it's recommended to have upwards of 3 servings of fish per week. And what we find, it's interesting statistics, we find in societies where they consume a lot of fish that the incidence of heart rate are much lower. Olive oil is another example of an omega 369, what you call omega 3 fatty acids, the omega 369s. And they're not just, they're these versions, oops, whoa, meant to say 369. Yeah, I don't know about an omega 4. You'll find these now. For example, when you go to select eggs, they'll talk about eggs that have good omega 369 cholesterol, and these are healthy forms of cholesterol that help to scrub out your pipes. So I'll just leave it at that. There's so much I could say about it. But if you're sitting around eating chips and being a couch potato, you're not really getting healthy doses of good fats. And it's odd to say that, isn't it? Good fats and bad fats. Bacon grease, for example, is a saturated fat, lots of low density lipoprotein. Not good. Okay. I know that bacon's all the rage right now, but no. No, 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 no. I'm not a fan of consuming large amounts of fatty bacon. If you look at the fat that's left over, if you store bacon in a the bacon the warm fat in a cup and let it warm up, just look at it afterwards. I don't think you'd want that in your body, not long term. Here we go with an arterial blockage, and what's formed right here is a cholesterol plaque in this region right down here. And it becomes sort of embedded in the wall of the blood vessel. And you can see that it's starting to occlude, is the official term, is starting to occlude the lumen of the blood vessel. So lumen is just, there we go, is just this, from here to here. Ooh, I made a mess. And that's where the blood vessels have to fit through. Now, sometimes that lumen is really small, like in capillaries, and in arteries, they're much larger. So usually blood vessels can pass through. What can become a major problem is if that plaque, if it expands and blocks the blood vessel, that will occlude blood flow. What becomes a major problem is if that plaque tears off and, like a plug, plugs up the blood vessel. And that can also happen. So there's really two things: it can grow and occlude the vessel, or it can come off and block the blood vessel, a bit like a stopper. And when you think about your blood vessels, we have seen this slide before, but the idea is that blood has to flow through, and it can't flow through if, obviously, if the vessel is trapped, so to speak. Okay, so we'll come back to blood pressure there in a second. I was just trying to get a sense of how far I was going to go here. There we go. Okay, so when you look at a heart attack, and I'll make this a little bit bigger here, I want to talk about the differences in the symptomology of men and women. Study of the symptoms. In men, there will be that crushing chest pain. It'll feel like an elephant is standing on your chest. A lot of sweating. The person will look like they're running a race, but they're just sitting there. You'll get this nausea. I remember Jerry the King Lawler on a. You might not have heard of him, but if you ever watch professional wrestling, he suffered a heart attack live on air during the Monday night show, and he vomited right on set. And he was pretty lucky because in professional wrestling, even though it's fake, there are people around, a lot of EMTs to look after people, and he had a lot of good care just waiting for him, and that was instrumental in his survival. You also get this incredible pain, particularly in the left arm. You'll feel it in the left arm, and it can go up your neck, it can go into your shoulder, and it's just almost a paralyzing pain. In men, the symptoms, well, it says a sudden onset. Some people who are suffering a heart attack you'll get sort of minor symptoms for a couple of days, but once the vessel is occluded and the heart muscle is suffering, and hopefully not, but could be dying, the symptoms can come on very quickly. Now, female heart attacks can be very, very different. There's this feeling of indigestion or heartburn. They can sort of feel like they have an upset stomach, and you don't see that in men. So this is kind of if someone told you they had, oh, I feel like I've got heartburn and it feels so good, and I feel like maybe I'm coming down with the flu. But one thing that is kind of common is because there's reduced blood flow in the heart, they'll have malaise, which is fatigue, and shortness of breath. You should see that in both males and females because the heart is racing, so this muscle is pumping and pumping. It's not getting enough of what it needs, specifically blood for itself. In females, obviously not at the mercy of testosterone like in males. Males our blood vessels tend to become occluded or plugged up more commonly than females. That's because of testosterone. It doesn't help. In females, you may see this may take a while to come on, but there's no hard and fast rules. These just are tendencies. So I wanted you to know the facts. Okay, so when we look at a heart attack, I'm going to step through this here. And so the heart will be beating, and it has to beat. It's amazing that it never really becomes tired. You need to exercise it as much as you can. By exercising, you increase the blood stroke or the volume that it can pump. Now, what will happen here, we'll sort of zoom in on this coronary artery here, and a cholesterol plaque forms. And I'll hit pause there. So you've got a coronary artery. The plaque is decreasing the blood flow, and that's like cutting off gas to an engine. Never good. And the plaque, this is right here, what you'll see is the plaque itself can form a clot. And this is interesting. Platelets can seal off the plaque like this, and you'll essentially kind of get a blood clot that'll also begin to form. And you can see when that clot forms, or if the plaque occludes the entire diameter of the vessel, essentially what you've got is, they call it a thrombus. What that means is it's just a clot, but this will block the blood flow, and now the heart muscle down here that is being supplied with blood isn't getting what it needs. And this just becomes sort of like a car wreck up here in the coronary artery. It's fine over here, but this section of the heart now becomes ischemic. It's pumping without getting any oxygen, and the heart muscle will become damaged. and potentially die. So we'll zoom out here, leaving scar tissue. This is hard to recover from. One of the encouraging sort of research items that's been coming up is the idea that stem cells can be injected into the heart tissue to grow new cells to replace this heart muscle. Because even though someone's had a heart attack, you think, oh, they'll recover afterwards. Well, it's not like this grows back so well. So, recovering patients will have exercise regimens, what they can handle, and then you slowly increase it over time. But wouldn't it be nice if you could replace the damaged tissue? And that's where stem cell research is stepping in. And yeah, it's a good thing. Okay. Sort of look at a second phase of a heart attack. And this is sort of like a spasm. It's kind of interesting. View it here. If a coronary artery, like the one that you're looking at here, and it's the blockage of the arteries that is like the biggest deal, they can do this. So this is kind of like a spasm. It could be in response to something. You could be allergic to something, anaphylaxis, and you could get this blockage of blood flow. And at this point, it's kind of like an asthma attack in your respiratory system. And in this case, there's no thrombus, there's no embolism. Blood just simply can't flow. And the result will be the same. If blood can't flow, you'll get damaged heart muscle. And the pain in the jaw and the left arm, that will all come on just as before. It results in the same results in the same conclusion. Not good. So I've got to take a little look at what causes this a little bit more. This plugging of your pipes. Now, a normal artery, when you look at the endothelial lining here, it's nice. It's open. This is you with your young, healthy blood vessels. And then you're eating cheeseburgers with bacon, not helping, and you begin to form a cholesterol plaque. Now, Bill Clinton, former president, he noticed that when he was trying to get in shape for his daughter Chelsea's wedding, that he said he couldn't seem to get any more endurance. He was running all the time and he couldn't get any endurance. And what was happening to President Clinton is that he had basically atherosclerosis, say that 5 times fast, and it started to plug his pipes. And if this builds up, obviously you can get the clotting, which you see here. And he did have well, they don't like to call it heart attack all the time. The proper term for an event, a cardiac event, you call it a myocardial infarction. That just means myocardium, that's the heart, and infarction means something went down. It was a big deal. And it's caused by this plugging. Now, if you want to make sure that something goes through here to help you out, you can eat, if you get good fats, omega-369s, they'll help to scrub this out. Also, if you keep your fiber uptake, that famous saying, an apple a day keeps a doctor away. Well, there's fiber that when you eat goes into your blood. And that fiber itself is soluble, and it can scrub your pipes. So if you eat apples, that's great. If you eat beans, they're extremely high in fiber. That's one of the reasons beans are the musical fruit, as they say, because they scrub out our insides so well that we produce a lot of gas. And yes, that's why you fart, because you eat beans. But if you're eating a lot of soluble fiber that goes into, well, there's insoluble fiber, like when you eat salad, a lot of it just goes right through you. But some of that soluble fiber will go into your blood, it will scrub your pipes, and it can help undo this. So, eat a diet rich in fiber. Yes, an apple a day does keep the doctor away. But if you like, what do I like? I like dried apricots. My parents would always send those when I was in university, and they're extremely high in fiber. Beans, and in cultures that consume a lot of beans, lentils, etc., it's good. Yes, vegan consumption is good for your health. Lots and lots of plant fiber. And again, just another shot of that buildup, and you get that clotting. Basically, the blood cells running into each other, and they can't get by. Okay, our last topic, and I'm going to jump into this and try to conclude fairly quickly here, is to talk, let's see here, about blood pressure. So I'm going to go back to our friendly slideshow. There we go. And we need to talk a little bit about this good old 120/80. Now, what it means is it's the pressure of blood in your blood vessels that can displace mercury. And I know what you're going to say. What are you talking about, mercury? Well, if you've ever looked at the, actually, it doesn't show it here. I'm going to leave for just 1 second. Here you go. If you're in the doctor's office and they put this on you, sometimes it's mechanized and sometimes it's um, just sort of the older device, right? The cuff. This looks a lot like an old style thermometer where they used to use mercury in thermometers, but that became a bit of a problem when they would get dropped. You don't exactly want toxic mercury going into the air. But in doctors' offices, you will still see this, and this is mercury. That's kind of ironic because they're showing it in red here, mercury silver. But they'll put the cuff on your arm, and they'll put a stethoscope right underneath it, and your brachial blood vessels run up your arm here. And the idea is we want to see if the pressure of the blood surging through your arm, that pressure gets transmitted to the basically to this thing's called a sphygmomanometer. There's a big word. And the pressure of blood going through your blood vessels pushes this up. So the pressure that's here is echoed and read over here. And it's measured in millimeters. So how high can the blood surging through you push the mercury up? And you just measure it in millimeters. Now, ideally, the pressure of blood surging through your blood vessels will be 120 millimeters of equivalent pressure and raise the mercury that high. So from this point on, I'll just say it should be about 120, but I mean 120 millimeters of displacement. Okay. So now that we've seen what it looks like, it's a very handy tool because if you have high blood pressure, it's probably because you've got a potential narrowing of the arteries. And that's obviously never good. Right? It's indicative of a potential future heart attack. So I'm going to go full screen. And if your blood pressure is, say, 130, sometimes if you talk to nurses, they'll say 130/90 is the new normal. But it kind of depends on your age and your gender. If you're pushing over 130, if it's upwards of 135, 140, that's high blood pressure. We call that hypertension. And that's not good. You don't want that kind of pressure because it can also lead to a stroke. Those little blood vessels in your brain, right? Think of those capillaries that are fairly fragile. If under pressure they burst, you can get a blood clot, and that can prevent blood from flowing to the brain, which leads to a stroke. And stroke symptomology will be, in many cases, people will suffer paralysis of the left side of the body. So what do we got here? Turn on my pen. Saves power. It shuts off too fast. Okay. So the first pressure, the 120, is when blood surges through the arm. Okay, so when blood surging through the arm, I drew this before, but I'll draw it again. If this is a blood vessel, that will be just blood flowing, just sort of flowing through. That's not a surge. That's actually, let's draw the surge now. The surge would look like this. Blood surges through, and of course I'm over dramatizing it, right? The blood surging through, and it's a big wave. Your ventricles in the heart have compressed, and you've got a big surge of blood going through the body. So that's what we're talking about here. And that should put pressure on the device, which will be reading here, and the device will feel that pressure and transmit it to the machine for recording. So what they do is they'll put the cuff on extremely, very tightly. And when it's super tight, you can read the systolic pressure which is basically when the ventricles of the heart. Huh. My pen, I'm going to have to do some learning with this. But that's a ventricular beat. And diastolic pressure would be after that. So this is after the ventricles have fired. So it's like active pressure versus post-active pressure. The pressure afterwards is much lower. Blood isn't surging through the heart. The ventricles aren't squeezing. So it's not as much of an event, so you have lower pressure. Now, I'll show you that. I have to turn off mirroring. There we go. All right. A neat little animation here. Okay. So as your heart beats, you'll have ventricular pressure, and then it drops. And then the ventricles pump again, and it rises. So you kind of have these low and high pressures. The high pressure is the systole, and down here we have the diastole, or the lower pressure. Okay. So when your ventricle beats, 130 is a little bit higher than is recommended. I mean, the ideal is 120. And if, for example, if this were your blood pressure here, you can have higher blood pressure. For example, when you're exercising, your heart's beating very fast. It's beating very hard. And it's when we talk about taking your blood pressure measurement, we take it at times when you're relaxed. We want to know what your normal pressure is, not what your athletic pressure is. And you can have some pretty high readings when you're exercising. Now, I wanted to get to this point because what I want to show you is the cuff is very, very tight. And a doctor or a machine will pump it so high that it's not really letting the blood through the arm. And the thing about pressure here, your arteries squeeze very hard. So what happens is the only blood that is going to get through your blood vessels is going to get through your arteries. So you have a constricted artery, and what you'll hear when the pressure is really high, you listen for this whoosh, 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 this sort of tapping sound. And you only hear that consistent tapping sound when the cuff is super tight, because only really your arterial pressure can squirt the blood through, and that's your ventricles. And you should hear that tapping, that whoosh, 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 whoosh sound, ideally when the pressure that's read is about 120 millimeters of pressure in the Sphygmomanometer's recorder. Now, so it's 120 millimeters of pressure, and you're hearing that tapping sound. And then what happens afterwards is you let the pressure off the cuff, and you let the sound. You listen to the sound as it comes down like this. As you let the air out, that tapping sound will just go away. And as that tapping sound goes away, pretty soon you don't hear the tapping sound anymore. And right here, you look at about 80 millimeters of pressure, and you don't hear anything anymore. Well, that's because there's no constriction on the artery. So the tapping sound that you hear would be your upper number, and once you let off the pressure, as soon as it goes away, you don't hear any more tapping than what you are is at your diastolic pressure or your lower pressure. And that's it. That's how blood pressure works. The tapping and the listening for nothing. Kind of exciting, but that's how they do it. So a machine is basically programmed to do that. You can get cuffs for your wrist. I have the old wrist cuff one, and it's just putting pressure on the blood vessels there, but it's not as accurate. And with the new smartwatch technology, they're talking a little bit about being able to register your heart rate. But one thing the smartwatches won't be able to do is they won't be able to register blood pressure, because they would have to squeeze the devil out of your wrist, and they don't do that. At least not yet. I don't know if I want to watch the cranks on my wrist every once in a while. You want to have as many measurements as possible over time, because you want an average reading. That would be something that if you presented to your physician would be useful. Who knows? Maybe with smart tech we'll get there. Okay. So if you have a high blood pressure, what do you do? Well, you could take what are called water pills, and they're also known as diuretics. Diuresis is a sort of a Latin word that means water. So diuretic pills can help you shed water. But if you shed too much water, you can also lose too much salt, which can potentially cause muscular contraction problems of their own. So you'd have to watch that. You don't want to have an imbalance where the heart starts fluttering because you've lost too much salt. If you've ever had muscular cramps, one of the best solutions is to have a better salt balance. But regardless of this, look, when you eat corn with butter, which is extra calories, don't cover it in salt. Because if you increase the saltiness of your blood, you increase your blood pressure. Yeah, I'm talking to you guys, where I see you eating chips all the time and or sugary sweet things. And if you make your blood really concentrated, well, what happens next? You get super thirsty, and that's your body trying to dilute that concentrated blood of yours, and your blood pressure rises. Yes, eating chips raises your blood pressure. So does eating corn just drenched in or just caked with salt. So eat healthier. Try to follow a balanced diet. Don't get crazy on little diet spoofs. Increase your fiber intake. Eat apples, apricots, beans. Even a lot of nuts are very high in fiber. Almonds are really, really good. Okay, don't eat something you're allergic to, needless to say. And you've got to record your blood pressure regularly. Now, look, if you can't get it under control, what are some choices? Well, they have these things called statins, and you might have heard of some of these statins without getting into medication too much. You might have heard of one called Lipitor, which is a brand name. You might have heard one called Crestor, which is another kind of statin. And what they do is they prevent the formation of cholesterol in the liver. 70% of your cholesterol is being synthesized in your liver, and that includes that bad LDL form. So if you want to lower that number, take that bad number down, then you can take statins. Statins can come with side effects, so you have to be aware of what those side effects are, but stay in close sort of communication with your doctor. Okay, folks. Well, I think that really about covers it. Um, Absolutely. The next topic, sorry, not trying to make you dizzy here. The next topic we'll look at is the electrical system of the heart. We're going to look at what's called the cardiac cycle. And it's a pretty neat one. So tune in, and we'll see you soon. And thanks for listening, folks. Have a good one.